Well, good morning, good evening, good afternoon, everybody watching this lecture. It gives me great pleasure to be with you here today. I'm Dr. Ahmed Adel. I am one of the pediatric cardiologists in Al Jalila Children's Heart Center, which is basically Dubai Children's. It is the only children's hospital in United Arab Emirates. Welcome to the World Down Syndrome Congress, Dubai 2021. We will talk today about the hearts of babies with Down syndrome, and the lecture is a closer look at their beautiful hearts. I have no disclosures. I honestly think that Dubai should be proud to have a children's hospital, a state-of-art hospital where all pediatric subspecialties are there, and Down syndrome patients need a similar place to cater all their needs and all the services they require during their lifetime. This hospital started in 2016, and we have been taking care of Down syndrome patients along with the other specialties in the heart center. And probably we can be sure that cuteness comes in different shapes and sizes. And Down syndrome patients are probably some of the cutest of our patients. Now let's go straight ahead for the discussion, and let's give a quick reminder of what a normal heart is supposed to look like. This presentation was dedicated for parents, so I'll try as much as I can to be simplifying it and not mentioning so much of a medical jargon. So a normal heart is formed of 4 chambers. As you can see, there is the right heart, which looks red here, and the left heart, which is red here, and the right heart, which is blue here. And each side of the heart has 2 kinds of chamber: the pumpy chamber of the heart, which is the ventricle, and the baggy chamber of the heart, which is the atria. So we have here left atrium, left ventricle, right atrium, right ventricle. And the reason red is red and blue is blue, that the red color blood is basically the oxygenated blood, which carry oxygen and go to the body and give the body the oxygen it needs. And after the oxygen being taken from the blood turns back to the heart blue to go then to the lungs to carry more oxygen and come back to the left side of the heart, and then to the rest of the body in a muscle that works 24/7 from first day of life. Actually works from even fetal life when the baby in his mom's tummy until end of the life. And when we talk about Down syndrome patients and their heart problems, we have to know how to find out troubles. Now, sometimes Down syndrome diagnosis is a surprise for the parents, but from my observation, the bigger surprise is when they found out that there is the baby has a heart problem. So the diagnosis really starts really early, starting from the time of probably pregnancy. So there is a fetal echocardiography, and Down syndromes, it's a must that they go through the anomaly scan to see if they have any issues or any problems. And one of the important organs being screened during pregnancy is the heart, which is called fetal echo. The service is available in different places in the country here, and in Jalila Children's also we have the service, the fetal cardiology clinic. So when we diagnose, the parents are ready, they know about the disease, they know about the diagnosis, they know about the management plan, and they are better ready, and we are better ready when the baby comes. Uh, However, if the patient was not diagnosed during pregnancy and diagnosed after delivery, so the gold standard test is usually is actually the echocardiography, which is basically ultrasound of the heart. It's similar to the ultrasound of pregnancy, but to the heart, and it is done in the cardiology clinic, and other modalities that we need some time to collect more information is the cardiac catheterization, which is basically a keyhole procedure to collect certain information. So, what to look at and look for in babies with Down syndrome to figure out if they have a heart problem or not. So usually parents will come to the healthcare provider, to the physician, and say, "I feel my baby is breathing very fast. They breathe fast as if they are playing football all the time." I'm talking about tiny babies that 1 day, 2 day, 1 month, 2 months old. They are breathing fast all the time. And here we have to be clear that babies in general, normal babies, they tend to get a faster breathing than adults. And but in babies who have heart problems, the breathing is really fast. They complain that they are not able to feed properly, so they won't finish their bottle, or they cannot finish breastfeeding in 15 minutes. They take an hour to finish the breastfeeding. Parents would notice that they really sweat a lot during feeding, as if they are in a football match, or running a marathon. And if you go to a physician and look at the weight gain from birth, generally speaking, Down syndrome tend to be slower in growing, but there is a certain standard chart that Down syndrome should follow, and these babies doesn't follow that, so they have a very poor weight gain, and this is important information to give a hint or clue that there is a heart problem. Another symptom is that the baby turns blue during crying. Babies sometimes turn blue when it's very cold or they are not warm enough, but turning blue when crying, turning blue when irritated, or blue all the time should really ring a bell. So what to do if the parents faced with this clues, these symptoms? Definitely, I cannot reiterate enough about, if the baby is unwell, you have to go to the nearest emergency. I would advise the patient go to children's hospital emergency, but if the baby is unwell, just don't take chance. Go to the nearest emergency or home, and they will diagnose, stabilize the patient, and take it from there to the right place. However, if the baby looks stable, you can go for your family physician or pediatrician who will take a good history and have the suspicion, and then eventually all patients who have heart problem will have to go to the pediatric cardiologist for proper diagnosis and then tailoring a management plan. So I'll give a bit of flavor about the heart problems that we commonly encounter in Down syndrome babies who have some heart problems. So one common heart defect in Down syndrome babies who have a heart problem is what we call the famous complete AV canal, or complete atrioventricular canal, or another name for it is AVSD, or atrioventricular septal defect. Excuse my medical terminology. It will be you'll understand it more when we talk about this diagram here. So this is a normal heart. As we talked, there is 4 chambers, right? And you can see clearly that between these 4 chambers, there is a septum, or a wall, that separates the blood and does not allow the blood to mix. Yeah, here. These are the ventricle, and this is called the ventricular septum. And these are the atria, and this is called the atrial septum. In the complete AV canal, or the AVSD, this part here, this small part here, tend not to form, and it's called the cushion of the heart. And because of that, all the adjacent structure does not really form properly. So you would find a big canal here, or like a big hole in the middle of the heart with a total mixing of the blood between all the chambers. This is the first problem. Second problem I'll talk about today is a VSD, or ventricular septal defect, which is a self-explanatory. So this is the ventricular system, which is divides the two ventricles, or I mean, it separates the two ventricles, and again, it should be intact. However, here you find that there is a hole, and this allows the blood to go from the higher pressure chamber, which is basically the left ventricle, to the low pressure chamber, which is basically the right ventricle. Another heart anomaly is an ASD, or atrial septal defect, which is again the atrial septum here, which should supposed to be intact with no hole. There is an important hole here, and the blood tends again to go from a place where there is a higher pressure to a place where it's low pressure. So it usually goes from the right side of, from the left side of the heart to the right side of the heart. Another unique anomaly that a Down syndrome baby can have is actually a constellation of 4 problems. It's called tetralogy of Fallot. And have a look here on this normal heart. Again, there is intact septum between the two pumping chambers of the heart, the ventricles. And you can see what you are seeing here is called the pulmonary valve, pulmonary artery. And this is right ventricle pumping the blood into the pulmonary valve and then pulmonary artery. Pulmonary means lung, so this is a lung artery. In this problem, the tetralogy of Fallot, there is a constellation of symptoms. So you'd find that this part here has moved closer to the counterpart, and then this area is very tight, and the blood going to the lung is really less. So you'd find this is a tight area here, and the blood is not able much to go to the lung. And in addition to that, there is a new hole here called VSD, where the blood also mixes through it. And then you find here that the right ventricle is now thicker because this area is tight. So this is what, when we talk about the tetralogy of Fallot, and the babies that has that are the ones who are blue. They are usually blue when they cry, sometimes even when they are not crying, and this should ring a bell and bring a patient to the medical attention. I'll give a flavor about the treatment options for kids that have a heart problem, Down syndrome kids that has a heart problem, or any kids as well. So treatment option can be medication, cardiac catheterization, and surgery. So medication, and we will talk about each of them briefly. So medications usually, the purpose of medication is to alleviate the heart failure symptoms and the heart failure means that the patient is not able to breathe, is not able to gain weight, and these medications really try as much as possible to help reduce these symptoms and allow the baby to grow. There are other medications that help with the cyanosis. You would hear this term sometime, which means that the baby turned blue. So when we talk about babies that are turning blue, it is a cyanosed baby. So we have medications that try to help with that as well. Second modality is a cardiac catheterization, or what we call a keyhole procedure. So the cardiac catheterization is basically you can look at this diagram. This is the baby, and we go from the groin here with a very tiny needle, and we go through the blood channels or the blood vessels of the baby, and we go all the way until up to the heart here, and we do different things. These things could be a treatment or diagnosis. So we gather. So the purpose of catheter. Let's have a look at this diagram here. So this is exactly how it looks like. The doctor standing here, the baby is sitting here, and this is called the X-ray machine. It's a live X-ray where we can see inside the heart, and our material we use inside the heart can really help to do what we want to do. It is a keyhole procedure. The purpose of it is to gather information. So sometimes there is important information that we cannot get except with the cardiac catheter. The second purpose is sometimes treatment. So there are certain holes. We talked about ASD, VSD, and in the cath lab we can actually sometimes close these holes with this cardiac catheter and save them from open heart surgery and the cardiac surgery. Sometimes we do open tight valves or arteries. You remember when I talked about this disease where there is a tight pulmonary valve or lung valve. So we can in some patients go with a balloon, go in this tight area, open the balloon, and then take the balloon out, and the area become wider than it used to be, and this helps the patient to get better. And cardiac catheterization is in sometimes life-saving. So a patient come very sick, in a bad shape, and then some of these patients we take them to the cath lab and we save their lives in the cath lab with the life-saving procedures. So any children's hospital heart center, children's heart surgeon should have a very good cath lab team to do these things. And of course, surgery in many of these patients is the definitive treatment. So surgery, sometimes it is usually surgeries are from the chest, so either from the front of the chest or the side of the chest. Either of these, either from the front or side. The purpose of surgery is a full correction. So you do the surgery and you treat the patient once and for all, and then and the problem is a history. Or sometimes with a more complex problems, you might need to go for a staged correction where we have to take the patient for 2 to 3 surgeries over the early years of life, and as much as the family gets anxious about surgery, but actually each surgery helps a patient and improves their quality of life. And of course, surgery can be also a life-saving surgery. So we are faced again with problem where patients who have a heart problem come in a bad shape, and surgery is a life-saving option for them. One thing that I have to shed light on, that whatever I mentioned from treatments now, especially in Down syndrome patients that have a heart problem, it is a multidisciplinary team. So it's not only one doctor that takes care of the patient. You can see in this slide 10 specialties, and I think even more will be involved in a Down syndrome baby who have a heart problem. So we have the family physician, the pediatricians, the pediatric cardiologists, nurses, surgeons, ICU doctors, dietitian, physiotherapist, speech and language therapist, occupational therapist. It is really a big team, and usually Children's Hospital will have this team under their roof, but it's not a one-man show. So, ladies and gentlemen, let me take you to the take-home message here. Kids with Down syndrome have to be screened for heart problems. Yeah, I in my opinion, every kid who gets the diagnosis of Down syndrome need to visit the pediatric cardiologist at least once. I believe that Children's Hospital is the right place where kids who have heart problems, or actually all Down syndrome kids, has to be registered to and visiting. And again, multidisciplinary team approach is the right way to deal with these children. This was my last slide. I'd like to thank you very much. This is my email, and you can email me if you have any question about the presentation, or if you need to ask anything about the heart problem. Thank you very much, and I'd like to thank Dr. Manal and the organizing committee and board for inviting me for this presentation.